Welcome to this lecture about osteochondroma. An osteochondroma is a benign noncancerous tumor that develops during childhood and adolescence. It's an abnormal growth that forms on the surface of a bone near the growth plate. And when a child is fully grown, the growth plate hardens into solid bone. As a child grows, an osteochondroma may grow larger as well. Once a child has reached skeletal maturity, the osteochondroma typically stops growing too. Here we'll talk about the symptoms of osteochondroma. In many cases, solitary osteochondromas don't cause any symptoms. The symptom may arise long after tumor develop. Osteochondromas are most often diagnosed in patients aged 10 to 30 years. The main symptoms of osteochondroma include a painless bump near the joint. The knee and the shoulder are most often involved. Pain with activity. An osteochondroma can be located under a tendon, which is the tough, fibrous tissue that connects the muscle to the bone. When it is, the tendon may move and snap over the bony tumor, causing pain. And then we will talk about the numbness or tingling. An osteochondroma can be located near a nerve, such as behind the knee. If the tumor puts pressure on a nerve, there may be numbness and tingling in the associated limb. Osteochondroma can make a change in blood flow. A tumor that persists on a blood vessel may cause periodic change in blood flow. This can cause loss of pulse or change in color of the limb. Change in blood flow resulting from an osteochondroma are usually rare. When we talk about treatment, we distinguish between non-surgical and surgical treatments. In most cases of solitary osteochondroma, treatment consists of careful observation over time. The doctor may want to take regular X-rays to keep track of any change in the tumor. The doctor may consider surgery as a treatment in these cases. If the osteochondroma causes pain, if the osteochondroma puts pressure on nerve or blood vessels. Finally, if the osteochondroma has a large cup of cartilage. To completely remove an osteochondroma, we will perform a surgical procedure called excision. In this procedure, tumor will be removed at the level of the normal bone. And how long it takes to return to daily activities will vary depending on the tumor size and location. In clinical examination, we can see and feel a hard, stable, clearly prominent mass at the medial side of the distal left femur. Here in the X-ray, we see a clear bony exostosis proximal and close to the epiphyseal line of the distal femur with a wide basement or neck. In the coronal MRI, we distinguish between the bony part, which is dark here, and the shiny white cap, which is the cartilaginous cap. Here is a clear comparison between the appearance of the osteochondroma in X-ray and MRI, and why the clinical and the MRI sizes are bigger than it in X-ray. In the sagittal and transverse MRI, we can see the wide bony basement. And here we can see the bony part with blue arrows and the cartilaginous cap with red ones. We can see the popliteal bundle with the green arrows and saphenous vein and nerve with brown and yellow arrows. The vastus medialis oblique muscle is clear here with white arrows. It's very important to distinguish and to determine the sites of these important structures to decide about the suitable exposure for the surgery. Here we see the exposure, the anterior-medial exposure over the tumor. And after dissecting the soft tissues, we can see the cartilaginous cap with white color And by using the electrocautery, we can draw a line at the basement of the tumor at the level of the normal cortex. Then, by using the mallet and the chisel, we cut the cortex at the previously determined level with a drawn line to separate the tumor from the normal bone. Then we remove the osteochondroma out of its place. Here we are using the bone chiller to smooth the cortex at the site of the tumor to prevent any suspected injuries could be caused by the spiky cortex. Then, the lavage with normal saline is very important to remove the bony fibers and blood clots. At the site of tumor, we put some bone wax to prevent massive bleeding. And here we can see that the whole basement site was filled with bone wax. The vastus medialis oblique was totally protected, so we can start full range of motion in the knee as soon as possible.